Welcome back to the Marcus Milione podcast. I have Sean again, and today we are joined by George Hodgin. He and I got connected through my dad. I actually spent a bit of time pseudo interning for him. Maybe I was doing a bit of financial modeling and kind of just asking him pretty much a lot of questions about how his business was being run. All I wanted to do was be submerged in the startup space, which is what he's in, and I learned a lot from him. So I'm very glad to have him on the podcast, and thank you, George, for hopping on here.
My pleasure. Good to be with you.
So I want to get obviously to the business, but I think for people to fully understand you and who you are, if we could pull it all the way back to maybe even pre-high school, because I feel like maybe there will be some reoccurring themes along the way. So did you have hobbies or anything you were into growing up that you thought, okay, well, maybe this will be a career, or like how it changed from what you're doing now?
Yeah, totally. I'm in the cannabis startup space now, so that was not a hobby growing up. My parents will be glad to hear. But I grew up fishing, camping, being outdoors quite a bit, and sports. I don't know. You can probably not see me, but 5'8", stocky, slightly overweight. So pro sports wasn't going to be a career. Could have potentially been a pro bass fisherman or something. I don't know. But those were the hobbies: sports, lacrosse, football, camping, fishing, being outside, and that outdoorsmanship, I think, and teamwork, team attitude, camaraderie is probably what led me to my first career, which was in the military. Excuse me, in the military. So I think there's some tie over there. Um, Obviously, you can't practice too much about being in the military when you're little, but being outside certainly was a good tie over.
Okay. And you got into the military after college, right? You went to UNC, and I believe you were a part of the ROTC program there.
I did, yes. So I graduated from UNC Chapel Hill in 2009, and I did the ROTC program. I didn't enjoy it that much, frankly. I thought it was a bit of a distraction from like the normal fun of college, but it was good. You know, got me up early, exercising, that sort of stuff. And then after UNC, became a Navy SEAL officer. So I graduated from UNC Chapel Hill on Mother's Day, I guess, of 2009. Their graduation's always on the Sunday of Mother's Day, and then Monday took off for San Diego to report to BUDS, which was SEAL training. So it was pretty nuts. But UNC Chapel Hill was an awesome time for any sports fans. We won the basketball national championship that year, which is, college basketball is a religion in North Carolina. So it was an awesome time to be there.
So that seems like a pretty big jump from UNC ROTC to Navy SEAL. So what kind of developed in between then, where you kind of saw this direction? Kind of Navy SEAL, obviously extremely prestigious. That made you think like, oh, I kind of want to pursue this.
Yeah, when I was little, Marcus, back to your question about sort of pre-high school, I had grown up wanting to serve in some way. Um, I naturally gravitated towards the military. My dad was in the army. He got out of the army, well before I was born, but both grandparents served in World War II. So I sort of naturally gravitated towards the military. And then September 11th happened. I was relatively young. I think I was a freshman in high school. But it was basically like, man, I've talked about this, joining the military, serving. Then 9/11 happened, and it was like, all right, I got to put my money where my mouth is. So if I'm going to do this, I'm going to do sort of the most intense, the most selective, where I think I could have the highest impact on the front line. So I decided I wanted to be a SEAL. I wanted to go to the Naval Academy forever for the longest time. Ended up getting a really lucky and fortunate and got an awesome scholarship at Chapel Hill that was basically like too good of a deal to turn down. So went there, and that was the intent behind my joining the ROTC program. It was a means to an end. That was, if I went to Chapel Hill, I was going to try and finagle my way into the SEAL program through ROTC, which fortunately worked. But it was definitely a change of pace, like to go from fraternity parties to BUDS training within 2 weeks was nuts. No, I immediately after I graduated, my dad and I loaded up my like beat up Ford explorer and drove to San Diego, drove across the country basically right after graduation, and then checked into buds, reported to buds, and started almost immediately. So there was no time off.
I find it fascinating, kind of, that you weren't too fond of the ROTC program, and then you go and decide to jump to the highest level of like military operations. Did you question yourself at all? Like, I didn't even like ROTC, so what makes me think I'm gonna like being a Navy SEAL?
Yeah, that would have been a good idea in hindsight. No, I think my complaints about the ROTC program were basically that it was just like almost make believe. And so I thought it should be more intense. The majority, or the overwhelming majority of the students in the ROTC program were not going to go on to be SEALs. Um, so the program worked really well for them. For me, I wanted it to be a little bit more intense. I thought the physical fitness standards should have been higher. Um, I thought we should be shooting guns a lot more and like getting ready to go into the military versus kind of like marching around the UNC Chapel Hill campus. So I thought it should be a lot more intense. That was my main complaint about it.
Yeah.
I feel like a lot of people, you think of a Navy SEAL and obviously extremely talented, but like very serious and very task oriented, like only focused on one thing. But you were just mentioning these fraternity parties and like, so was there a shift, or did you just know how to flip the switch on and off?
I think I know how to flip the switch on and off. I think you'd find about your observation of SEALs is a really good one, which is that most of us tend to be hyper focused and hyper driven for like whatever we're doing. So it could be running or training or operating. It could also be like reading a book or gardening. But I think you'll find that most guys, whatever they're doing, are like all in on whatever that thing is. So for me, it was like, all right, I'm at Chapel Hill. There's all these amazing academic opportunities, extracurricular opportunities, social opportunities. So I wanted to do all the rides. I wanted to do everything. So I think I was super intense about being a UNC student going through that experience. So for me, on the social front, that was having fun, going to basketball games, going to parties, simultaneously training for buds. So that was hard because oftentimes they're competing or conflicting, but nonetheless figured out a way to make it work.
It seems like it worked out for you.
Yeah, I mean, I don't know if it's like a mix of my dad's government background and like hearing stories of like former SEALs that he knew or something, but I've always had this like crazy respect for just like how serious the mentality is and how different it is than just like a normal civilian mentality of like going through hard stuff. And so I'm curious to hear about buds, because I think as just a normal American, you're fed this idea of like Hell Week is super hard, like crazy. And I'm sure it is, but most people don't realize that buds is, I think, a year long, correct?
Yeah, it's about a year. Yeah, potentially longer, just depending on like the way the holidays fall, the way that your training schedule falls. And then after buds, there's between, again, 6 months and a year, depending on your specialty, of advanced training before you even join the SEAL teams. Basically, if buds is like your undergraduate, then what's called SQT, SEAL qualification training, is kind of the graduate program where you like actually get down to the business of being a SEAL and what it's like to shoot and communicate and skydive, things of that nature. So yeah, it's a long time. It's the best analogy that I've heard to describe it is like it's like eating an elephant, and the only way to do it is sort of one bite at a time. If you sat down at the beginning and said, "My God, I have to do this all day, every day for a year or 2 years," nobody would be able to do it because it's too much to try and comprehend at one time. But if you can take it sort of hour by hour, day by day, then you kind of blink and a year has passed.
That kind of leads me to my next question was, like, when you first got there, I imagine it's just so overwhelming. You have all these people you don't really know. Actually, you probably have never met. And then, you have people who are giving you instructions probably at 1,000,000 miles a minute. Your head's flustered. So, like, how do you just adapt? Is it just a huge learning curve, or is it just kind of, you're all in this together, let's suffer through it and get the most that we can out of this?
A little bit of both. You're totally right. there are people from every walk of life, every geography, black, white, Native American, Asian American, doesn't matter. It's the ultimate equalizer. Like nobody cares who you're from, your socioeconomic status, you're treated the exact same, which is basically like shit. Um, it's the great equalizer. So that allows people to bond really quickly and build camaraderie really quickly. And I think it's certainly not a game because it's life and death and it's intense. But if you understand sort of the purpose and intent behind it, which is like you're never going to be right. There's always going to be too much information. There's always going to be too many things happening at one time, which it's designed to be like war. So if you can figure that out and just realize, okay, I can control the things in my control, which is basically my emotions and how I react to stimuli, then you will likely get through the training. I think it's the people that become too flustered or try and deal with all of the external scenarios going on at one time that aren't able, without being able to process it sort of individually. Those are the folks that unfortunately don't make it through training. So mix of all of the above, processing, lots of stuff going on, basically just understanding what's in your control, what's not, and then building camaraderie with your teammates to make it through training. And I think most guys develop a pretty almost like morbid or dry sense of humor, to where you're just like, look, my body's not even my own anymore. Like all I have is my mind, um, because you're cold, you're hungry, you're wet, you're tired. And so I think the sooner that people just sort of toss their hands up and say, all right, I can't deal with the physical pain, but I can mentally and emotionally choose how I react to the pain. Those are the guys that end up making it.
Yeah, I was gonna ask you.
Same.
My limiting knowledge of like Hell Week and like Bud's training is through like documentaries or like YouTube videos. Um, but I was gonna ask, like, do you think the people who don't make it, and you said unfortunately don't make it, they're more mentally exhausted than physically exhausted? Like, do you get past the point of being physically exhausted to where it's all a mental battle?
Yes, I think, and for different guys, it happens at different times. Um, for me, I mean, Hell Week was really challenging, but it it was absolutely a struggle. And for people that don't know, Hell Week is 5 days of no sleep. You're running over the course of the week. You probably run several marathons. You're under pretty intense physical strain, mental strain. That for me was really challenging, but it wasn't like make or break. For me, the make or break was in a later phase of training, where you do a lot of like underwater sort of combat diving, scuba diving. For me, that was the most stressful, just being like underwater and oxygen deprived. I could like deal with the cold, I could deal with the sleep, but that for me was sort of my breaking point. So for different guys, it happens at different times. And then I think one of the ways I've heard it best described is like it's 90% mental, 10% physical if you're in really good shape. If you're not in really good shape and your body can't withstand the physical pressures, then you won't even have the opportunity to like turn it into a mental challenge because you or your body will break. So I think 90% mental, 10% physical if you're in outstanding shape.
So I guess one of like a very well-known Navy SEAL guy, David Goggins, talks a lot about just being able to compartmentalize like pain or really like not knowing how far you can actually push your body past its quote unquote breaking point. For you in the underwater stuff, and I'm not 100% sure on this, but I'm pretty sure you do forms of like drown proofing, right? So it's like, do you have to accept in your mind that you might just go out like underwater and work through like that panic that's setting in because you might literally pass out from not having oxygen?
Yes, that's right. Yeah, so David Goggins was an instructor of mine, which is really neat, and he was super intense. I mean, he would during some of the instruction phases, he would, he'd instruct, which is physically challenging and mentally challenging because you're basically like chaperoning or proctoring all these pretty high risk evolutions. So the instructors, it's hard on them too because there's so many moving parts and they're managing it. And while it feels like chaos to the students and it's designed to be chaotic, it's the military, so everything's controlled. I mean, you feel like you could die at any moment, and in some instances you could, but there's paramedics there, there's ambulances there, the instructors. You don't know as a student which one is which, but there's instructors who, while they're being stress inducing and being like mean, so to speak, they're medics, they're paramedics, and their sole job is basically to look for guys under stress that could end up getting hurt. So it's really challenging for them. But Goggins would, he'd finish his day as an instructor, and then he'd go on like a 30-mile run and just not sleep, and then he'd start the next day. So I think the part of the challenge and fun of buds is realizing that your mind is so much stronger than your body, and you can push through it. For me, that exactly like you described, Marcus. For me, that came in the form of some of the underwater drown proofing. Basically, they tie your hands and feet and throw you in a pool, and you have to like bob and swim for a long time. And again, as a student, you're like, holy shit, I'm gonna die. So you have to like get comfortable with that feeling and control your stress reaction to it. Realistically, though, there's, again, you don't know it, but there's instructors and paramedics and lifeguards watching the whole time with an ambulance there ready. So you're well protected. And very unfortunately, but two students just, I think like last week or 2 weeks ago, two students just passed away in training at the conclusion of Hell Week. So it absolutely is high risk. It absolutely is stressful and dangerous, but it's as controlled as it can be. It's like controlled chaos almost.
So when you ultimately get deployed and you're in some of your maybe like hairiest situations, did you feel as though like something kicked in maybe subconsciously, like I've been here before, like there is no, I mean, yeah, you probably still felt some level of fear like with your life in danger, but it was more of like you turned robotic or almost mechanical in your decision making and like next steps?
Yeah, I think the most intense uh, times of combat that certainly I felt, I looked back at points of buds and was like, all right, I can do this. Buds was really, really challenging. That being said, nobody's shooting at you in buds, so it's a different type of stress. But I think the mindset and the foundation that buds breeds carries over through the rest of your career in the SEAL team. So the same intensity with training before you even deploy, it carries through from buds. So like the training super intense. You basically rehearsed every single thing that you'd see in combat hundreds of times so that your instincts take over. I heard somebody describe really well, like in combat, you're going to revert to sort of your most basic level of training. So if because it's just so stressful, there's so many things going on, however you can increase your base level, that's what you're going to revert to. So SEALs, I think there's a misconception or maybe a mischaracterization that SEALs have all these like fantastic capabilities. That's absolutely true, and people work really hard and are really good at their jobs. That being said, I think what SEALs do the best is they just get the basics right. So like we know that our basics have to be and our fundamentals have to be perfect because that's what we're going to revert to. So like while there's sort of interesting, sexy capabilities and like really advanced tactics, advanced training, we know that you're going to revert to your basics. So people get the basics right.
So after buds, and I don't know exactly how the process works, and you don't have to get into any of that, but I assume you're just put on a team, and then are you with this team throughout your career as a SEAL?
Yeah, what ends up happening is at the end of SQT, so like SEAL graduation, which is an awesome experience. Your families come out. There's a big ceremony. There's a dinner and speeches, and it's a really really special culminating event. Basically, the class gets broken into there's West Coast teams and East Coast teams, and they're basically just geographically different, some cultural differences, but not material. It's more like a sibling rivalry almost. Half the class will go to the West Coast, and then half goes to the East Coast. And most of the guys that get sent, they go to one team. So like I got assigned to SEAL Team 4. So most of the guys from my graduating class that went east to Virginia Beach, most of those guys end up on the same SEAL team. And then with that team, you're typically together about 4 years. So it's basically 2 deployment cycles. And then a lot of guys will either stay at that team for a long time or they'll rotate back to to become a trainer or an instructor, or they'll go off to a specialty training, or they'll go to graduate school, or they'll work in DC at the Pentagon as an example. But that first team where you're assigned, typically about 4 years, kind of becomes like your calling card, your home base. It's a really really tight knit, pardon me, really tight knit group.
I was gonna say, like, the relationship that you all must have had is unlike, I think, anything certainly Marks and I would experience,
Mm.
because you've just been through like extensive amounts of like training together. So do you keep? I assume you keep in touch with all of them.
Yeah, but most guys, I think most guys stay in really close contact. Um, I think what I've found is that even absent of regular touch bases or communications, when for whatever reason people end up getting together, if it's a wedding or a funeral or a reunion or whatever, the bonds, despite the passing of time, the bonds are incredibly tight. So, like, just as an example, my first 2 years in the SEAL teams, I was living out of Norfolk, Virginia Beach area. Um, I was married at the time, and I was home. My wife and I had a house in Virginia Beach. It was like a 2 year lease, and I think I slept there like 14 nights, maybe 15 nights out of 2 years. And like the rest of that time, you're with the guys training overseas, on the road, school, at a different school event or something like that. So you spend more time with your SEAL brothers by far, like incomparable to the amount of time you spend with your family. So that engenders incredible bonds. I mean, the older guys sort of become. Some guys are like 18. I was 23 when I first got to my team because it was after college. Some guys are like 18, fresh out of high school, and there's SEALs who are 40, 45, 50 years old that have been doing this for 20 years, 25 years, and so like those guys become father figures or older brother figures to some of the younger guys. So it ends up becoming kind of a loving, dysfunctional family. It's like a sports team, honestly. It's like the locker room environment on a sports team, which is like, guys giving each other shit. They fight, they get mad, but they love each other, and they always sort of shake hands and come back. So it's an awesome. I definitely miss the feeling of brotherhood and camaraderie. Like I miss it every single day.
So I've followed your wife now on social media for a good bit ever since you had mentioned that she's on there. She does a good job, like kind of literally documenting anything, which is what I find is hilarious because there's you, like, people think Navy SEAL super serious like guy, and then if you see George on her Instagram stories, it is hilarious, right? But I wanted to ask, like, there has to be a certain level of stress put on a relationship because you are most of the time doing things that you really can't talk much about. So I imagine there was a lot of times she was very much in the dark about you have to leave, and there's like really nothing she knows about where you are or what you're doing.
Yeah, 100%. There is an inordinate amount of stress put on children, spouses, parents, even parents of SEALs, and we have two young boys, and so like I know what it's like to have kids. I cannot imagine the stress I put my parents through just thinking like, all right, if I knew my kids were in danger, it's crazy. Sadly, the divorce rate in the SEAL teams is like 90. I think it's like 92%. Um, so like, God bless the families and spouses and partners that make it work because they suffer, or they serve. I should say they serve just like their husbands or partners do. They sort of hold down the fort at home. They bear emotional and mental stress, just like their husband or wife in some instances of SEALs that are support or women that are supporting the SEAL teams. So it's absolutely a familial stress. I mean, my wife and I got married. We basically had two weddings. We had like she was living in Manhattan at the time prior to my first trip to Afghanistan, and I was supposed to leave like 2 months later. And we got a phone call. It was like, hey, you're not leaving for Afghanistan in 2 months. You're leaving in like 6 days. So we were supposed to have a wedding, traditional wedding, white dress, preacher, that kind of thing. And so we delayed that until after I got home from Afghanistan. But we went and got married at the courthouse in Manhattan, like just the two of us, because that's where she was living at the time. So like, you basically just have to figure out how to like roll with the punches and just kind of like throw your hands up and realize your schedule, your time is not your own. It belongs to the SEAL teams 100%.
So, so yeah, so life after being a Navy SEAL, you just casually went to Stanford Business School. How did that happen?
Yeah, I slipped through the cracks somehow. They let me in. I think, yeah, I think the same drive that made me want to be a SEAL is I was like, all right, I've got what I thought were good leadership skills, good management skills, sort of raw acumen that had really been those parts of my development had been really well polished in the military. I didn't have business skills, professional commercial skills. So it's sort of the same thing that led me to be a SEAL. I'm like, all right, if I want to enter the business world, like what's the hardest place to get into? What's the most rigorous business training? Like, all right, I'm going to go to Stanford or Harvard or something like that. I think looking back, is that necessary? Probably not. I'm very proud to have been from there. It was an awesome formative experience for me. Um, but there was definitely some like, all right, I got to gravitate to what's the hardest thing because that's what I'm used to in the Navy. And I absolutely loved it. It was definitely a challenge um, to go from that like locker room, mission driven, purpose driven environment where there's just so much camaraderie. Like I didn't realize how much I missed it, and I didn't realize how much I took it for granted at the time. Again, like the sports analogy, like how many guys would give their left arm to like go back and play one final high school football game, high school lacrosse team, high school lacrosse game, whatever, because you just don't know how good you have it until you enter, when you enter the real world and then it's gone. And so I didn't know how much I would miss the day to day of the SEAL teams. Like there's, it's an organization just like any other, and it's certainly bureaucratic. It's the federal government. So there's administrative pains in the ass and things that are annoying, your travel claims, whatever, like things that are just annoying that you don't think about in sort of the day to day of a Navy SEAL. All those aside, I absolutely missed the SEAL teams after having left, and like while I was at Stanford, for sure missed it.
There was probably how much time between you deciding to leave the SEALs and you getting into Stanford?
There was about 6 months. So in the interim, yeah. So I left the SEAL teams, and then in I think May-ish, and then started that fall. So started the academic year, 6 months later. So my wife and I didn't have kids at the time. I was like, all right, we wanted to like do something fun, basically like get to know each other again, spend some time together. So we ended up spending several months in Telluride, Colorado, which is kind of a outdoorsy, music, really fun Colorado town. And so I interned at a venture capital firm while I was there, basically to like pay the bills a little bit, get some professional skills, and have an excuse to live in Telluride and hike and fish and just hang out.
Yeah, we were actually just took our family vacation there last Thanksgiving, so
Yeah.
it's amazing. You're totally right about all of that.
Small world. It's such a special place. It's incredible.
So you go to Stanford. I actually had in some of the research I was just doing on you, even though I worked for you a bit, but you talked about a class with Irv Grossbeck. I want you to touch on what you kind of touched on in your talk that I heard you giving about delivering bad/unpopular news, because I think that it translates extremely well into business, but it's also something that I'm sure you had to do quite a bit of in the military as well, because things just don't go according to plan 90% of the time. So I thought that was very insightful, the way you talked about his class. I'd like to hear you kind of elaborate a bit on it some more.
Yeah, so Professor Grossbeck is one of the seminal instructors at Stanford. Like, if you talk to a Stanford alum, it's always like, man, did you get to take Grossbeck's class? He's like, Mr. Stanford Business School kind of, and he's been around for decades, so he's seen it all, and very successful entrepreneur, businessman, and just like exudes empathy and leadership. Just a really genuine, authentic, caring person. And he teaches his class, which I thought was really, really groundbreaking. Basically, he takes, and I forget the numbers, if it's 10 and 10 or 15 and 15, but basically he takes half the class as business school students and half the class med school students. And basically he's like, look, in order to be a successful doctor, in order to be a successful business person, you have to be able to deliver really challenging bad news in an empathetic, direct, honest way. And that's something that's hard to teach in a textbook. So he basically takes these business school students and the med school students, and it's a course taught at Stanford Hospital, and you basically deliver all day long and role plays, and in some instances, sort of with real patients, with real people, you're delivering really bad news. You know, hey, you've been diagnosed with XYZ disease, you have 2 weeks to live, or hey, I'm sorry, man, your husband didn't make it out of the surgery in the emergency room, whatever, but like life-changing, life-altering news for people. And it's something you just have to practice. And so what I took away from that is a couple things. One is, I think the point of the course is people in business or in a high stress situation, be it the military or medicine or whatever it is, they're not going to remember what you told them, but they're going to remember how you made them feel. That's what they're going to internalize for the rest of their lives. And so if you're delivering challenging news, it's important to recognize the gravity of the situation and not be so detail oriented that you come across as apathetic or unempathetic. And so delivering that bad news and trying to make the person feel as if accurately and authentically that you care about them and you know that the message you're delivering is impactful or potentially negative. And so trying to learn that and then implement it in business has been really formative for me, and certainly like could do a lot better. Tons of growth that I should have there, but that was a really foundational course for me and was awesome. Basically, if you're telling someone bad news, you got to get it out within like the first 15 to 30 seconds. Otherwise, it's not fair to them. Their mind's going to wonder. It looks like you're sugarcoating something. So, like, be direct, be honest, be authentic, and get that bad news out as fast as possible.
Wow. Yeah.
Got to be tough.
The transition kind of back from military to civilian life was probably, I imagine you, whether you knew it or not at the time, like there was emotional baggage that you were carrying with you. That's just kind of how it is. Did you ever find yourself kind of seeing the quote unquote problems that people were dealing with in the States and thinking like, you guys have no idea. Like you really have no idea how hard some shit is. And you are sitting here complaining about some of the most stupid stuff I've ever heard in my life. Like, especially on a college campus, I'm sure it went through your mind like, this is a non-issue.
Yeah, yes, 100%. And I think there was a period of time, certainly in grad school, where I did have that attitude, and it didn't feel good. It didn't feel natural because it felt very judgmental by me. Like it doesn't matter what a problem is. Like if it's someone's problem, it's that person's most important problem, irrespective of how that would stack up for me. And so I went through this period of exactly like you described, Marcus, being like, this is bullshit. Why are people getting stressed about this? Like, stop the complaining. Everybody's safe. We're happy to be at Stanford. Like, isn't that enough? Why could you ever complain about whatever it is, stress, academic work? And that wasn't really healthy because it became really negative. It became really toxic. It's a little bit egotistical. Like I felt egotistical as well because basically like, oh, I've seen so much more. Therefore, I get to have ownership over and judgment over like whatever I think your problems are, and that's not a very fair way to look at things. And it kind of turned me into like a disgruntled employee almost. Just not being able to be happy and trying to judge, always judging other people's problems because I was this veteran and look at what I saw. That's not what I wanted to be. So I didn't. To your point, a lot of that was me not dealing with emotional baggage or things that I had seen. And so, I started talking to people about it, and it wasn't unique to me. Like tons of former SEALs go through that. I'd say almost every former SEAL goes through that. Part of it is just leaving like your tribe, leaving the brotherhood, and judging everybody else that didn't do it, that didn't go through SEAL training. And so I've tried to work really hard to to just accept things for what they are without judgment. And that's hard for me to do, but I found that I'm happier, more productive, more pleasant to be around when I try and just accept things, accept whatever people's stress or struggles are without viewing it through my own lens.
So you're transitioning, kind of back into the normal world of just like academia and, trying to figure out your next move. And I'm sure as you keep in touch with your former Navy SEAL team members and like you talk about the struggles, and then it eventually leads to, you founding this, biopharmaceutical research company. And do you think talking about issues like PTSD and such was kind of like the driving force to pursuing this?
Yes and no. I think the same impetus and drive that I had as a SEAL to serve and to like find whatever purpose or whatever mission, that has me energized about my current job and my current role. Like I feel like I'm leading a team. We have a purpose. We have a mission. That's enough to sustain, or that drive allows me to sustain and overcome just the emotional and professional ups and downs of being in a new industry or transitioning out of academia into the corporate world. So I think that has been a large part of my motivation. I think so many veterans, particularly post September 11 veterans, struggle with processing their experience and like all the stuff that happened in Afghanistan over this past year, the past 6 months, really, I think has exacerbated that. It's like, what the hell was I doing there? Like, God knows how many friends I've buried or that have sadly like still have not been able to overcome their wartime wounds, and like all that just kind of like coming to the surface after we watched Afghanistan, where most of us sort of bled and grew up and had formative years, just kind of get turned back over to the Taliban. And so like I think that engendered a lot of conversations around PTSD, chronic pain, whatever it is. And so basically, what motivates and energizes me now is potentially helping develop alternative healthcare treatments to treat things like PTSD or pain. Because I think most veterans struggle with it, whether or not they know it. Like, nobody is the same. No one is the same after having served in the military, whether or not they saw combat. Like, you are not the same person you were when you went into the military than when you left. Some of that's really positive. You grow up, you get more discipline, you understand sort of how to deal with stress. Some of that's not positive, things like PTSD. And so I think there's been a good movement and kind of the national dialogue around being able to talk about things like mental health. And that's not unique to military or veterans, right? We see athletes doing it all the time and stepping up, and high-performing corporate executives talking about treatment, therapy, coaching. So I think veterans play a large part in that. Certainly what excites me and where my experience lies, but more generally, I feel like just the country as a whole is getting better at wrapping their heads around, or at least acknowledging mental health.
So, for people that don't know, and I don't want to speak for you, but Biopharmaceutical Research Company is essentially looking to produce pharmaceutical grade marijuana strains that are federally legal, like at the federal level. Like, you guys don't dabble in the state like legal stuff, right? Or has that changed?
That's correct. No, that has not changed and won't change. So we're fully licensed by the federal government, the DEA, to take cannabis, marijuana products through FDA trials to help people. We don't prejudge any of the science, so there's certainly things that are bad about marijuana. It's not a panacea. I think it's sort of mischaracterized that it's just this completely harmless substance or plant. Like there are, like every drug, like every compound, there are positives and negatives. Our goal is let's produce legal, clean, consistent, compliant cannabis, and then turn that into legitimate medicines to help the most amount of people possible. And part of being licensed by the DEA, the federal government, is that we don't violate federal law. So even though we're located in California, we don't participate in the California legal, federally illegal market. So like a customer of ours is a university, a biotech company, a pharmaceutical company, perhaps a CPG company, but not a dispensary or an individual consumer.
Yeah, regular civilians can't just walk up and buy like your strain of product. Um, I know that when I was interning there, the biggest and hardest thing you guys were dealing with at the time was the becoming federally, I mean, I guess regulated or approved, like going through the regulation process to be federally compliant. Now, I want you to just talk a bit about it because I don't think people understand that while you may see states with legalized marijuana, it's still federally illegal. And so,
That's right.
yeah, you were kind of navigating that for a pretty long time.
Yeah, three and a half years. And I think, sort of going back to the first part of the conversation, I think it would have been impossible to be patient and persistent in the face of all the changing regulatory requirements and the diligence and licensure process by DEA. Um, that would have been impossible had I not had my military training. Like a lot of it goes back to that SEAL training. So that's that played a part in my personal and professional development. So to sort of to your point, despite the fact that 200 million American consumers or individuals live in a state where they, as a consumer, can access cannabis for recreational adult use or medical purposes, the institutions that want to touch cannabis the most and have the most to benefit and probably help the most people, biotech, hospital systems, pharma, universities, they can't violate federal law. So even if cannabis is legal in their state, they're still regulated by the FDA and the DEA, which say that cannabis is a Schedule One drug, meaning they can only get it from a producer that's also licensed by the federal government, just like us at BRC. So they cannot, Stanford University can't go, despite their in fact they're in California, they can't go to a dispensary and buy cannabis to do tested on rats or rodents or in a laboratory setting. They have to come get it from somebody like us, which means that we have to produce to a really high standard from like a product sophistication, a cleanliness, um, and a compliance standpoint. So we're regulated by DEA, the Federal Narcotics Agency, the Drug Enforcement Administration. So we have to follow all of their regulations, not the state regulations, which is challenging, but also we think that's where the opportunity lies.
Mm.
So when it finally became federally legal for you to start researching this, was there like a shift in your focus? Was it primarily before this happened, we need to get through this regulatory like approval phase, and then once it happened, was it kind of like all hands on deck, or how did your
Yeah,
mindset change?
totally. I mean, it was basically like shift in priority. So for 3 years, the priority was go through the DEA regulatory process. That's all that matters. Nothing else matters. Like, how do we set the conditions to be successful there? As soon as in the summer of 2021, late summer of 2021, we made it successfully through that process. So then it was like immediately shift fire and change priorities to, all right, now, maintain that, do everything in our power to maintain that and honor that licensure. But now it became production time. So it was sort of pre-production and production. So production time, now we're rocking and rolling. We're in our second batch of products, meaning our second crop, um, working with researchers, biotech companies to take what we produce and go out and create new drugs based on those, and public health, public policy. So the team was ready, the conditions were set, the manufacturing facility was ready, and then my focus came. Okay, maintain the DEA licensure, but we've got it. We're on the other side. Now it's all about scaling production. That's it. Yeah, basically. I think you're right. It's so complex and niche and sort of sophisticated what we're doing that it requires, unlike a consumer app or a traditional cannabis company where like basically if you believe in the market and the team to execute, you kind of see the playbook. For us, there was a ton of education on behalf of investors. Like, here's exactly what this licensure means. Here's why it's important. Here's why we think we're set up the best to receive it and to win the process. And if we do, here's our market opportunity. And so there was a ton of education. The raising capital was really intense for me because it was just so much diligence on behalf of the investors. But it was awesome. We're really lucky, very fortunate to have long-term investors that believe in the potential. And it, you know, if you every state that legalizes cannabis and every country, traditional pharmaceutical spend drops 10 to 20%. So instead of using a traditional pain drug, people go and they use CBD or they go to a dispensary, whatever. So like if you can frame the market opportunity to the investors, look, we're gonna create pharmaceutical drugs out of cannabis, and if we're successful, here's what we'll be able to accomplish. And I think the ones that decided to partner with us, they understood the market opportunity, and that's kind of where they are now. Now this is the exciting part.
Mm.
Do you think there's real potential for, further down the line after more research has been put into it, you know, marijuana can start replacing some of the, opioids that commonly get prescribed for different reasons and ultimately, hopefully, would have less side effects?
Yes,
Or addiction type side effects? Yeah.
100%. The early data suggests that for chronic pain, certainly. For super intense pain, where like you still may need an opioid, if you just had it, you're in a car wreck and you had to have an arm amputated, like you're gonna need really, really intense pharmaceutical drugs. That being said, it looks like, and this is early, but it looks like you could perhaps prescribe someone less opioids, and you could prescribe them some amount of cannabis. So, and perhaps if you prescribe them less opioids, it's a less addictive dose, or maybe they don't have to take them as long, or maybe they only take them at the hospital and they don't have to take them at home. So you're lessening the potential for addiction. So there's all these important questions that I think we still need to answer around cannabis, but the early data is really promising, and that's that, yeah, cannabis probably can be used for chronic pain.
When I was doing some work for you, I remember just being so engrossed in like where you are in a market position, and I think that there is truly, I don't even know if you can put a number on the upside potential of the market, because it was pretty much illegal to research up until recently. So you have what is essentially a completely unexplored, untapped market of pharmaceutical grade marijuana that could be used for well outside of pain. It could be used for a host of different things. We just have no idea because there has been no research behind it or at a large scale.
Totally. I mean, as a red-blooded American and somebody that fought for this country, I think the U.S. should own this market. Right now, prior to us being in existence, most of the research that was being done around cannabis was done in Israel and Canada. And we should own this. We should own the IP. We should own the jobs. We should own the ability to help people. And you're right, it's not just chronic pain. People are looking at Alzheimer's, Parkinson's, fibromyalgia, epilepsy, anxiety, PTSD. The list of indications, diseases that could be helped by cannabis is remarkable. Like multi hundreds of billions of dollars of market opportunity, and more importantly, the ability to help people that otherwise don't have a choice or don't have an alternative healthcare treatment. There's one FDA approved botanically derived, meaning it comes from a plant versus being synthesized in a laboratory, but one botanically derived cannabis-based drug, and it helps children that are suffering from really challenging to cure or incurable epilepsy. So like that drug is making life livable for 12,000 people, which is incredible. I mean, how could you not be excited about that? Later on, the fact that one drug does $600 million in sales a year, that's really fantastic from an investor and a return perspective. So I think what excites me is there's the ability to build a wonderful, sustaining, impactful business while making the world a better place. And that is really, really cool. And it's something that we're pumped about at BRC.
I kind of want to leave you on this note. I feel like we could talk about this forever. It's so
same.
interesting. But what's kind of like your 3-year outlook compared to your 12-year outlook in terms of like limitations or what you foresee being problematic?
Yeah, with respect to cannabis. Um, 3 year outlook, I'll call it 3 to 5 year outlook. We think our products, right now, doctors can't prescribe cannabis. They can recommend it, and then you go to a dispensary and get it. You don't know necessarily where it came from. It's probably not the same product as you think you're getting. We think in 3 years, our products will be prescribed by your doctor, paid for by your insurance, and picked up at CVS or Walgreens, like any other medicine. And it's going to be the exact same every time you get it because there's really strict manufacturing controls. That's the future of cannabis. I think that's 3 to 5 years away, maybe sooner, but in that time frame. 12 years, man, I don't know. I don't think that far. I can't think that far in advance yet.
That's fair.
All right, George. I appreciate you hopping on here. If there's anything you want to plug, you can plug it here, or I can, we can talk and I can add it to the links description or anything. But thanks again for hopping on. It's always great talking to you. And yeah, until next time.
Yeah, guys, thanks very much for having me.